everyone. I welcome you all back to my channel once again, Doctor. My name is Dr. Ajonoma Osinana. If you are joining me for the first time, I welcome you in a special way. If you are a returning subscriber, God bless you. Today, I want us to talk about PARAGARD, an intrauterine contraceptive device that is based on copper. Yesterday, we discussed about Mirena, which is a hormone-based IUCD. Today, we want to make a review of PARAGARD. So please kindly sit back for the next 4 minutes and let us make a review of this. Thank you. Welcome back. Okay, so what exactly is PARAGARD? PARAGARD is an intrauterine contraceptive device that is based on copper. Okay, it is inserted into the womb where it does the work of contraception. So, how does it do it? The active ingredient, which is copper, is number one is a spermicide. In other words, it kills off the sperm to prevent fertilization. Secondly, it also disrupts the process of implantation because if fertilization eventually occurs, the zygote or the baby that is forming needs to attach to the womb. That process is called implantation, and Paragard can disrupt it and prevent it from happening. Okay, so what are the benefits of Paragard? Number one is it is long lasting. Okay, it can last up to 10 years. Okay, two, it is reversible. You can decide to remove it at any time you like. Okay, and also it can also be used by breastfeeding mothers. Some estrogen-based contraceptive methods cannot be used by breastfeeding mothers, but Paragard can be used, okay? Then it can also be used as an emergency contraceptive if used within 5 days of the intercourse. Emergency contraception is, what you do to prevent pregnancy when you mistakenly indulge in unprotected sex and that could possibly lead to pregnancy. So inserting Paragard within 5 days of that event can also work. All right. Then the next is the contraindications. Who are those that may not benefit from Paragard? Number one is people that have fibroid, especially large fibroid. They are not advised because the fibroid occurs inside the womb. So you don't put it there. There may not be space for it to put, or it may not work. Okay, the next are those that have pelvic infections, especially pelvic inflammatory disease. Also, those that with cervical or uterine cancer are not, permitted to use Paragard. Okay, then unexplained vaginal bleeding. Paragard is contraindicated in unexplained vaginal bleeding. Then those who are allergic to copper. Just like I told you, the active ingredient in Paragard is copper. So people that have allergy to copper or copper-containing substances should avoid Paragard. Also, those that have Wilson's disease. Wilson's disease involves accumulation of copper in the body, so you don't, need to add to that. Okay, by introducing a copper, containing substance. Then, of course, pregnancy. If you're pregnant, you are not expected to do it. Of course, before doing this, you should be able to do a pregnancy test to rule out pregnancy. Then, what are the possible complications that can arise in the process of using this? Number one is expulsion. Okay, the Paragard is usually inserted into the womb and it is T-shaped, and the two T-shaped makes it to hang inside the womb. So, but it can, one thing or the other can happen and it can get expelled. Okay, the second thing that could complicate this is rupture or perforation of the uterus. In the process of insertion, the uterus can get perforated. Also, cramping could be a complication, and then, of course, infections. And are there side effects of Paragard? Yes, number one is spotting. Okay, bleeding in between periods can happen. Then anemia. Anemia means low, blood level. When your red blood cells are lower than the required number, that's anemia. Then infections like pelvic infections, like PID in this case. Ectopic pregnancy can also happen as a side effect. Then back pain. Back pain can be noticed in people that are using Paragard. Then painful sex, dyspareunia, can also result from that. And of course, miscarriage can also happen in Paragard. If you have any question, please kindly drop it. If you have a confidential question that you don't want to make public in the comment section, please use the WhatsApp button on the screen. Okay, please WhatsApp only, do not call. All right, thank you so much for watching our videos. Remember to share and subscribe and share to your friends. See you in my next video. Bye.